For more on the government's response to this new variant, Carolyn Bennett is the Associate Minister of Health and the Minister of Mental Health and Addictions. Minister Bennett, thank you so much for speaking with us. How concerned should Canadians be about this new variant?
Well, I think that Dr. Tam and Minister Duclos have been, and Minister Alghabra, I think, put out a very serious plan that means that we always have to be vigilant, but the kinds of precautions that are there in terms of testing and quarantine, and to make sure that we do everything in our power to keep Canadians safe. So I think that once again we are relying on the science and the advice, and want Canadians to continue to understand how important it is to get vaccinated, to wear their masks properly, and to physically distance, and to really start to think about saying no to some of the things that were about gathering together inside. And so it is about what we can do as a government, but what we need Canadians to continue to take seriously. This pandemic is continuing to evolve, and we continue to need to reevaluate and give good advice.
I want to pick up on something you said in that answer right there. Is your best advice to Canadians that they might want to reconsider some of their plans? The holiday season is here. People are going to be spending time indoors. Do you think people in this country need to reevaluate their plans based on this new variant?
Well, I think as Global Affairs has said very clearly, I think that people need to really cancel their plans if they were thinking of going to Southern Africa or to any of the, to the countries that, may well be part of this new variant. But I do think that I've canceled my Christmas party. I wasn't comfortable having that many people in my house for in that kind of time where people maybe don't wear their masks or are being too close together. So I do think that Canadians need to continue to be vigilant, and I think some of us have felt all along that we can't let down our guard. This virus is very crafty and always finding ways to actually affect the social disruption that we've all lived for 2 years, but we can't let our guard down now.
So for Canadians at home right now, perhaps who don't have any travel plan to Southern Africa, don't expect to have any contact with anyone who has traveled from Southern Africa, looking at your example that you just gave, that you canceled your Christmas party, should Canadians at this time be looking to cancel their plans as well? Is that something the government would advise?
I think we will take public health advice, and I will take advice on travel from Dr. Tam, but I do think that most of us feel that if something is not necessary, that the kind of discomfort that I think a lot of us have felt on crowded planes and being there with people, we feel better now that there's been the vaccine mandates. But I do think that we now need to really listen to public health advice and observe that advice.
At today's news conference, Dr. Tam said that there's no evidence right now that this variant is in Canada. How do we know that? Have we been testing for this variant? For Canadians who look at the news today and think this seems to have come out of nowhere, how do we know, and have we been testing for this variant?
Well, I think the government of Canada has invested $50 million on the kind of research around new variants and the kind of testing that would be required. It is about knowing that anybody who's been in that region over the last 14 days need to present themselves for testing, and that we will do. I think Canadians understand how important it is that they be responsible on this, get the test, isolate till you've got the results. And then what happens, I think, in terms of even travelers, Canadians returning to Canada, in the advice that Minister Duclos and Minister Alghabra have said, you have to be tested on at that last point of departure in that last flight to Canada, tested when you arrive, isolate until you get that result, and then quarantine for 14 days. So this is as well as being tested on day 18. So countries like Canada that are testing appropriately, we need to know that that people will, we will find what exists, and then we will do the right thing.
I get going forward that, the world is talking about this variant right now. We are trying to learn as much as we can about it. But how do we know right now that it's not here? Had screening already been happening for this variant? I just don't understand. I'm curious.
Yeah, what happens in terms of the testing is it's an evolving situation, but we have been investing in the research into new variants, and so we are very aware that this is an evolving situation and that the testing needs to pick up these new variants.
Okay. I also want to talk to you about your new role. Yesterday, you had a meeting with Iqaluit's Mayor Kenny Bell, and I know he was on our program. He said that he spoke to you about the ongoing mental health crisis in the territory in Nunavut, and he told us on our program about the 5 suicides that had happened in roughly a week-long time span. I'm curious what you said to him about what kind of support the federal government can provide to try to deal with this growing challenge.
So firstly, I think the mayor was very clear. He was very happy with the response he'd had from Minister LeBlanc about the water situation, which was stressing his citizens. And I think that we know that that this is a very complex problem in which we need that kind of integrated youth strategy and services. He now has been able to purchase a building that will be a youth center where with the appropriate activities and programming and supports, and that we know that there is so much more to do. The Inuit youth prevention strategy has been supported by our government, and I knows he's got a real partner here with us at the federal government level.
For the first time ever, the federal government has an addictions minister as it's part of your portfolio. Is your government going to look at decriminalizing some illicit drugs as a way to deal with the opioid crisis?
So, Katie, absolutely. We have already received the proposals from both the City of Vancouver and the Province of British Columbia to look at what it would be to not charge drug users for small amounts, personal use, and we are looking at those 2 proposals now. This is one part of a much broader strategy. We are also in that exemption from the criminal code that would be used in those situations, also on safe supply. When I was in the downtown east side last Wednesday, Thursday, Friday, it was really important that there are these amazing organizations doing extraordinary work on safe supply, on supervised injection, on overdose prevention. We need to partner with those, develop the research. CIHR has been very, very involved in us knowing what works and who it works for, and so that no one is left behind in this very complex challenge. This is a matter of a toxic drug supply. It's poisoned, and we also have the new benzodiazepine contamination in the drugs as well. So even things like naloxone haven't been working in the same way. So I am pleased to be working with Minister Malcolmson there, my counterpart as Minister of Mental Health and Addiction, and with my counterparts across the country on a mental health strategy and substance use strategy for Canada, as well as a separate transfer that would make sure that we are directly addressing this really ongoing tragedy.
Just so I'm 100% clear, are you looking at decriminalization of illicit drugs on a national level?
What we're looking at is examining these proposals from Vancouver and British Columbia, and then being able to work with our community partners, building a system bottom up. We want to know what works and what doesn't work, and these will provide a very good template for this. I mean, Katie, my dad was a police officer before World War II. He, to the day he died at 93, thought that prohibition didn't work and a few people got really rich. So I think that we have to continue to carry on in really trying to treat substance use for all of its reasons, to intergenerational trauma, child abuse, all of the reasons why people end up needing substances or using substances to ease their pain. So we are working with those with expertise, those with lived experience, those with living experience, to be able to get the best possible policies to save lives and to get people onto a good path.
Minister Bennett, thank you for your time. I've gone way over time here. Thank you very much.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.